Well, thanks for having me. My name is Ryan Jouett. I have a practice in Bryan, College Station. We are an LVI practice. We have certain signature services that we provide. We do a lot of cosmetics, non-surgical facelifts. We do a lot of headaches, TMJ patients, TMJ cases. We also do dental implants and all-on-4 type surgeries with sedation and kind of focus on fear patients. So we kind of meld all those together in one. And so we really have a very comprehensive practice as far as who we treat and how we treat. So my background was I'm a AccuFilm and shim stock guy. So I would routinely adjust occlusion with AccuFilm and shim stock, and I thought I was pretty good at it. When I first got my hands on Tscan, it scared the hell out of me because I got what I thought was a pretty good bite, and then with Tscan, it showed me not only where things were hitting, but when they hit, and then how hard they hit in that same continuum. So that whole idea about you can read the dots on the teeth doesn't work, right?
Yep.
To be able to see that with Tscan was pretty amazing. So I instantly started to implement that, of course, in all of my orthotic cases, bite improvement cases, and then, of course, finishing in porcelain. So that is a part of my standard protocol for adjusting orthotics once the patients have a good home, and adjusting the porcelain for the same reason, so that I can get those teeth timed to be hitting all at the same time. I also use it often. You have that patient that comes in and you're doing like a single unit crown and you mark it with ribbon, it looks good, and they're like, it just feels high or it just is strange. Well, Tscan comes out immediately at that point because either it's not marking or I can't see it. So with Tscan, 100% of the time, it's like, oh, yeah, it's hitting exactly where you said, right? So for us, on the clinical side, selfishly, it's completely worth it. For the patient, we've got in our office like a huge 65-inch monitor in our operatories and a small 40-inch behind the patient at the 12 o'clock. And those are on all the time with whatever information we're looking at, photography of the patient, in this case, Tscan. And so the patient can see how we're improving when we're improving. So they're like, that feels better. Let's see what it looks like on the screen. Like they want to see the bite computer is what I call it. So for them, it's just cool because they've never seen anything like that. So it's just it's kind of like adds value to what we do because, like, I say this often, we're not building a bicycle, we're building a spaceship. And so when they see that stuff, they think spaceship, they don't think bicycle with
Yeah.
typewriter. For me, there is no way I would adjust a full mouth case to completion without Tscan anymore. When I first got my hands on it, it was a learning curve, not because it wasn't good, but because I didn't believe it, right?
Yep.
So you do something a certain way for a certain amount of time and you get proven wrong with it, even though it's been kind of working, it's hard to trust technology. So when I first started using it, it took a while to figure out, okay, I'm correlating these spikes with these dots and trying to figure out where to go. That took a very short amount of time. So that now it is incredibly faster. And I go back to the mouth with that in a full mouth adjustment case, maybe 5 times. So I do think about that. Full mouth of porcelain, upper and lower arch in 5 adjustments to get pretty close to perfect right on left hitting at the same time. I couldn't do that I can't do that with AccuFilm. So I'm really happy with that. So to me, it's invaluable as far as the treatment side. For the patient side, man, it just adds confidence to them in my treatment because I'm using they know that I'm using the latest and greatest. They see that, and they've never seen anything like that. And they're not going to see that in anybody else's office in our town. So it's a pretty cool value added kind of thing for the patient. If you're looking to add Tscan to your practice, and you're just, I mean, I would say just get it, because you you and I both know those patients who have horrible bites. Like, they are just all over the place. And so with Tscan, you have the ability to just during the consult use one of those wafers, have them bite down into it, and show them how everything hits at a different time. And then you've got the opportunity to show them a Tscan of someone who has a good bite, where everything hits at the same time with low levels of force, not these red spikes here, one red spike here. That's impactful. Like, they see that. They see the nails coming through the paper kind of thing. That's an incredibly impactful thing. But then secondly, like, it just makes your clinical stuff easier, especially on those hard cases where you're going to get one of those a month at least. You got this case, the patient keeps coming back for an adjustment. Tscan it. I mean, you Tscan it and it's fixed instantly. They're like, man, that feels so much better. Oh, great. By the way, what is that computer you use? That thing is awesome, right? So you get a good value added for your patients as well.